What is autism? Autism is what is called a spectrum disorder. This means that this little word, autism, encompasses a vast range of symptoms which may or may not be present in each individual on the spectrum. And those symptoms which are present will vary in intensity from individual to individual. Not only that, but the spectrum is fluid. The presence and intensity of these characteristics can change over time. Does this mean that I can be cured of autism? No. Autism is something that is present at the earliest stages of life and will persist throughout one's life. The first step in dealing with autism is acceptance. This doesn't mean that autism will rule your life or your child's life. Those characteristics of autism which negatively affect one's life can be managed. One can learn to cope and overcome, but it will take effort. This is why early intervention is so important.
I know there are a lot of things I can't understand, but I still want my life to have meaning.
I don't know that I want to hear from any more experts.
If you will please let me finish. Will you please let me finish? With intensive psychotherapy, an autistic child can be treated...
The Rimland report plainly shows that autism is not a psychological problem.
I am not familiar with the Rimland report.
Calm down, sweetie. Sweetie, calm down.
It would be better if you could get her to sit calmly. Try to control her.
What are you talking about?
But we were told self-stimming is good. It eventually calms them.
Self-stimming? Yes, self-comforting.
Self-stimulation, rocking, spinning, rolling on the floor, flapping.
Oh, I think spinning is good. And rolling, too. Self-stimulation does seem to eventually calm the nervous system. It can be a way to compensate for not being held. And being held by another person is scary, but rolling or being held by surfaces produces the calming effect that ordinary children get from a hug.
How old's your child?
Well, I don't have children. No, I'm autistic. And I need the sensation of being hugged. And I've developed a machine that I get into and hugs me, and I'm different afterwards. I'm more social. Well, I didn't speak until I was 4. Now I have a BA and a master's, and I'm studying for my doctorate.
How did you learn to speak?
Please don't shout. Please don't.
Most autistic people are very sensitive to sounds and colors. Overstimulation hurts. You know, people talking too much at once, can cause us to panic.
How did you get cured?
Well, I'm not cured. I'll always be autistic. My mother refused to believe that I wouldn't speak. And when I learned to speak, she made me go to school. And in school and at home, manners and rules were really important. They were pounded into me. I was lucky. All these things worked for me. Everyone worked hard to make sure that I was engaged. And they knew I was different, but not less. Now, I had a gift. I could see the world in a new way. I could see details that other people were blind to. My mother pushed me to become self-sufficient. I worked summers at my aunt's ranch, went to boarding school and college. Those things were uncomfortable for me at first, but they helped me to open doors to new worlds.
What characteristics comprise autism? The main characteristics are difficulties or delays in communication, social interaction, and repetitive or stereotyped behaviors. Communication. There is a delay or absence of language. What language exists is often one-sided, lacking in social reciprocity, and used to request or label rather than to comment, share feelings, or converse. Social interactions. People on the spectrum tend to be more interested in objects than people. There's also great difficulty with picking up on social cues, starting or maintaining conversations and friendships, and, in general, understanding the social structure, what to expect, what is appropriate, and understanding what is meant but not said. This results in autistics taking things very literally, such as a child looking around the room because someone said they heard rumors flying around. Repetitive behaviors, such as hand flapping, finger flicking, spinning or lining up toys, echolalia or scripting, which doesn't count as meaningful speech, excessive adherence to routine, which leads to great distress at seemingly small changes, such as taking a different route to school, or fixated interests, such as trains, escalators, vacuum cleaners, etc. Here's an explanation from an autistic girl of why autistic people engage in some repetitive behaviors. These behaviors are called stims, or can be better thought of as self-soothing behaviors.
Charlie, why do autistic kids cover their ears, flap their hands, hum, and rock?
It's a way for us to drown out all sensory input that overloads us all at once. We create output to block out input.
Carly's brain, unlike most people's, is overwhelmed by the senses of sight and sound, taste and smell.
Our brains are wired differently. We take in many sounds and conversations at once. I take over 1,000 pictures of a person's face when I look at them. That's why we have a hard time looking at people.
Through her torrent of words, Carly began to unravel the mysteries behind her often wild behavior. Like banging her head.
Because if I don't, it feels like my body is going to explode. It's just like when you shake a can of Coke. If I could stop it, I would, but it's not like turning a switch off. I know what is right and wrong, but it's like I have a fight with my brain over it.
Some early signs that a child might have autism. No big smiles or warm, joyful expressions by 6 months. No babbling by 12 months. No back and forth gestures such as pointing, showing, reaching, or waving by 12 months. No words by 16 months. No meaningful two-word phrases by 24 months. Remember, this doesn't include echolalia or scripting. And finally, any loss of speech, babbling, or social skills by approximately 24 months.
Remy, what are you making?
Now that I know my child is on the spectrum, what do I do? Getting your child enrolled in a therapy program as early as possible will provide them with the best chance of overcoming the obstacles that they face. The idea here is that the longer a person engages in a behavior, the more ingrained it will become and the harder it will be to change. If you can get your child enrolled in a suitable program, they will not only be able to learn appropriate ways of functioning and communicating, but the difficulties that they face as an individual will be specifically dealt with by the team supporting them.
When you're doing behavior management, you are really doing teaching. You have to teach an alternative. If you don't teach an alternative, you're leaving the client with nothing. Okay? If you make behavior go away, in a practical sense, you're saying to the person with autism, figure it out on your own. Figure out what to do next. Now, it's a social learning disability. They're not likely to pick the right social behavior to demonstrate for you.
So what therapy is best? There's no single approach that will be best for every child. It is essential to research what is available in your area, to talk to the various companies directly, and ask questions so that you can best understand each company's approach. In this way, you will be able to find the approach that will be best for your child and your family.
Again, the kinds of things that you look at in terms of intervention programs, they should be planned and intensive. They use curricula developed for children with autism. They're interdisciplinary because, again, the child's going to have many different needs: occupational therapy needs, sensory needs, speech and language needs, behavioral needs, maybe medical issues. Teachers have to have experience, training. Families are important in this. And why are families important? Because of the generalization. The nice thing about family involvement is they help kids learn to generalize skills, so it's not just learned in isolation. The tendency to kind of learn with blinders on is a real danger in autism. Having child really engaged is essential, looking at behavioral issues and thinking especially about the behaviors that both facilitate and interfere with learning. And finally, thinking about transitions of all kinds, from junior high to high school, from preschool to school age, from high school to adult, college, vocational. All these transitions are hard for people in the autism spectrum, and transitions in school program are especially hard.
Here are some important questions to ask. How successful has your program been for children similar to mine? Can you show me data supporting your approach? Does your approach have scientific research supporting it? All companies should be taking detailed notes on the day-to-day sessions, tracking the child's behaviors, and keeping data on the progression of skills. If the company doesn't have or take detailed data, consider this. Your child's time and development are far too important to be placed in the hands of someone lacking evidence. How many hours per week do you offer? More hours equals more practice, which leads to quicker fluency. True advances will take a significant number of one-to-one therapy hours a week. Some programs offer fewer hours, but this is generally geared more towards maintaining skills and doesn't provide the same opportunity to learn new skills. Does your program offer training for parents so that they can continue the therapy at home in off hours? Consistency is essential for a child to learn. If they are being taught to do things one way during therapy, another way at school, and a third way at home, the child is going to be very confused and progress will be greatly slowed. Will the therapy be conducted in a clinic setting, or in the home, or in both? What will a typical session look like? Will it be consistent? Children on the spectrum greatly value routine. This allows them to know what to expect. Not only that, but if the schedule varies greatly, it will be difficult to determine the causes to any specific behaviors or difficulties that might arise. What kind of training and credentials does your staff have? Do they have experience working with children on the spectrum? How many children from your program go on to perform well in a regular school setting? If your child has any specific behaviors that concern you, ask about how this approach would address them and what success they have had in modifying such behaviors. For instance, my child frequently runs off and doesn't respond when called. This is a serious safety concern for me. How would you address such an issue? They should be able to answer your question in a general sense, which should give you an idea of how they would begin to structure a program for your child.